Here at the Melon Initiative, we simplify medical information into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective. Today, we're joined by endocrinologist Dr. Peggy Amoa Kohene for a powerful conversation called It Might Not Be Your Thyroid. If you've ever been told your fatigue or weight gain is probably your thyroid, this episode is for you. We'll cover the difference between hyperthyroidism and hypothyroidism, when to ask for a second opinion, and what to do when symptoms don't quite add up. If you're new here, welcome to the Mel Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand it, and then to use it to manage your health and advocate for others. We have two missions here. The first is that health literacy, to promote it amongst the public and our peers. The second is to elevate the expertise of nurses, to bring awareness to all the career opportunities in healthcare, and then to share with our peers all the ways that they can leverage their expertise as both clinicians and entrepreneurs. If you're new here, and you haven't already subscribed, this is your chance. Leave us a comment, give us a thumbs up on YouTube, LinkedIn, Facebook, Spotify, Apple. Give us a 5-star review. Share this information with your friends. Every time you interact with our platform like that, it lets the algorithm know that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be having a medical emergency, you seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Now, when we talk about leaders in medicine who are not only brilliant at what they do, but deeply committed to their patients, their community, and the next generation, this woman's name stays at the top of that list. Dr. Peggy is a board-certified endocrinologist with a heart for patient education and a sharp clinical mind to match. She completed her fellowship at the University of Virginia and currently serves communities across Northern Virginia. And she was just named Northern Virginia Magazine Top Doc for 2025. And trust me, when you hear her speak, you'll understand why. Born right there in Washington, D.C., raised in Ghana, and now blazing trails in Virginia, Dr. Peggy's career has been fueled by purpose, passion, and determination to make sure patients get more than prescriptions. They get dignity, education, and care they can trust. Whether it's managing diabetes, navigating complex hormone disorders, or correcting myths floating around social media, she brings clarity, compassion, and evidence-based truth to every room she walks into. And when she's not saving lives, she's baking dairy-free chocolate chip cookies and scouting her next skydiving adventure. It's my honor to welcome her to the Mel Initiative for the first time. And join me, Dr. Peggy. Welcome to the Melanin Initiative.
Oh, that is the best intro I have ever heard. Thank you so much, Dr. Madison, and thank you for having me today. I'm super excited. A little bit nervous, but excited. So thank you once again.
Oh, well, first we must note we have a global audience, but the heartbeat of the show is the DMV, DC, Maryland, Virginia. So it's always a special honor for us when we're able to bring to the screen and to the sound waves clinicians and resources right there in our hometown. This show is a love letter to my hometown. And speaking of hometown, the reason you're even a guest on here is because you're my dad's endocrinologist. So shout out to my dad who made this recommendation. He's been a strong supporter since day one. And so thank you, Daddy. So is this your first podcast?
This is. So I am excited. And I also want to thank your dad.
Wonderful. At the time that we're recording this, actually, he's celebrating his birthday. So happy birthday to him. Before we jump into our questions and talk about thyroid, we want to get to know you a little bit better. We have something called our icebreaker, where we do 5 questions in 5 minutes. So the first thing is, what's the next big thing you want to be a part of?
Good question. This is a little bit off from medicine though, but I want to be a real estate tycoon, not just an agent, but a tycoon. That's one of my goals. It's maybe not now, but later on in life, I do want to be one of those names you think about when you're thinking real estate. So I have my doctor niche and my real estate niche. So that's one of the things.
So a tycoon in real estate. I wasn't expecting that.
My mom actually is. So that's what I aspire to be as well.
Oh, well, then it's not that far fetched after all. What is advice you give that you need to believe in yourself?
That we can always do better. I believe in people. So I always say, hey, you'll make mistakes, but you'll get over it. I believe that there's always light at the end of the tunnel. Sometimes I don't see it, but I do tell everyone I see that, and I think I need to believe that more. That there's always light at the end of the tunnel. It gets better.
What's your favorite sunscreen?
So I'm using one from Aveeno now. Um, it's just one of the Aveeno brands. I can't remember, but I like it. Especially for the one for my face. I have another one by my bedside, but the Aveeno one is the one I like to use. I think it works well for me.
I think it looks great. Yeah, what season in life are you in right now?
I'm entering my soft girl era. I'm not there yet, but that's the season I'm hoping to be in the next few weeks. It's my soft life era, my season of enjoyment.
Oh, wonderful. Well, I'm happy to hear that. I think if anyone deserves it, it's people in healthcare.
I agree, totally agree.
Okay, let's jump into our case study. We have Tanya. She's a 37-year-old teacher who's been feeling tired, gaining weight despite regular workouts, having irregular periods. Her provider ran a thyroid stimulating hormone test and told her everything looked normal. She was told to just manage stress and eat better. But she feels like something deeper is going on. What stands out to you about her story?
So for Tanya, who's 37, I see a lot of people like Tanya, right? It's um I'm tired, I'm gaining weight, I'm doing all the right things, but I'm gaining weight, I just don't feel right. What is it? And of course, they did a TSH, which is the thyroid stimulating hormone. That's normal. Okay. But you want to know, did they do the full panel, right? Is the free T4, is the T3 there? Did they check her antibodies? Those are some of the things that you're thinking. But of course, if you do all these and these are normal, then you have to start thinking, you know, what's making Tanya tired? Are there other medical issues? Are there other vitamin deficiencies? We want to delve into Tanya's diet. Yes, she's exercising, but what is Tanya eating? Some of her medications she's taking. Is there something that is making her tired as a side effect of a medication? So, you want to look at a broader picture. Delve deeper into Tanya's history, and not just say, "Oh, your thyroid is normal, so everything is fine," because it could be something else that you're missing, and not just the thyroid.
Okay, so let's break it down. Let's start with hyperthyroid. What are some classic signs of an overactive thyroid that you would tell her?
So the one of the common things that people complain about is something we call palpitations. Oh, my heart is beating too fast, or I can feel like my heart is pounding in my chest. So that's one of the things that, like, this could be my thyroid. Or heat intolerance. It's winter time or it's kind of cold. Everybody's in the sweater and you're burning hot. You're like, this place is so hot. Meanwhile, it's at 65 or 62. Something is wrong there. Then unintentional weight loss. I know we all want to lose weight, but if you haven't done anything and you're losing a lot of weight, sometimes there's more going on, right? It's not just, oh, I didn't feel like eating. Because usually with people with hyper or overactive thyroid, their weight loss, they'll tell you, hey, I'm eating, but I'm still losing weight. Another thing you want to look out for, change in bowel movements, pooping more frequently. Maybe you're someone who goes once a day, all of a sudden, I go 3, 4 times in a day. I'm anxious, I'm jittery, I feel like there's something, there's nervousness and increased sweating. Of course, some people might see changes in their hair and their nails. I'm losing a lot of hair. Irregular periods for women, middle-aged women who are having in reproductive years. So those are some of the things. And of course, not to forget, there could be an enlarged lump in your throat, what we call a goiter, or just an enlarged thyroid gland. So those are some of the things that would alert you to an overactive thyroid, what we call hyperthyroidism.
Okay, and now what about a hypothyroid? What would she complain about and what would you look for?
So the hypothyroid, with hyper, it seems like everything is revved up. With the hypothyroid, that's the reverse. Everything is just slow. It's like everything is dragging. So you're going to be more fatigued than usual. You haven't done anything drastic, but I am exhausted. Weight gain, hey, I'm exercising, I'm eating better, but I just seem to be putting on weight. My skin is dry, my hair is dry and breaking. You have brittle nails. Constipation is another one, right? It might be overlooked, but that's one key one. And then cold intolerance. So, unlike the hyperthyroid, now you're cold all the time. Of course, you want to make sure you're not anemic, though, that's why you're cold. But it's summertime, it's hot, we're all burning up, and then you're freezing. You want to think about your thyroid. It can also cause an enlarged gland in some people, not all people. So those are some of the things that you would look out for. If you notice you're having these, then you should start thinking this could possibly be my thyroid.
Hmm.
One last thing, it can also make your periods irregular. So both hyper and hypo can give you irregular periods.
So if we haven't confused anyone yet, right? Because it's a tricky diagnosis, right? Both for the patient and on the provider side. Why do you think some of these signs get so easily misread, particularly in women of color?
Yeah, so I think these labs are generally misread. When you're, I've had some very interesting stories. When you do the blood work and your TSH is high, right? Usually we're thinking hypothyroid. Unfortunately, some providers even get confused with this. So they see that the TSH is high and I don't know if they get confused, but they're not sure, right? So this could be missed. And then for the overactive, so it's always the reverse. Think about it. If your thyroid is overactive, your TSH would be low. Unfortunately, this confuses a lot of people, and even some people in the clinical medical world may get confused. For people with color, what I have noticed is sometimes these cutoffs, so I would use hyper, which is the overactive thyroid, as an example. The lower limit might be zero point 0.4, 0.45, depending on your lab. I have met a lot of women of color whose TSHs are on the lower end, but they feel fine, right? There's nothing wrong with them. They feel great. But their numbers, when they do the blood work, it will be flagged. So that's something that you want to be a little bit aware of. So you don't just generalize and say, hey, this person's blood work is flagged, they're sick, and then you put them on medication. You want to see their trend. So I've seen that with a lot of African American females I have seen, middle-aged in their reproductive years, some of them have lower TSH numbers and they are fine. It does not mean that they are sick, and it doesn't mean that, oh my gosh, there's a thyroid issue, I need to be put on medication.
Thank you for that. So, how common are these? I mean, for you, this is what you do every day, right? But how common are thyroid disorders and who's most at risk?
So thyroid disorders are quite common, but of course, especially in females, right? So for something like hypothyroidism, definitely more common in females, about 7 to 1 compared to males. Um, some we know that females are definitely more affected, both hyper and hypo. Um, as we get older, we tend to see more hypothyroidism on underactive thyroid. So age is the factor, but definitely women are more affected than men.
Do we know why?
So not necessarily. I haven't seen any studies saying why. There is some genetic component, and there is also environmental factors to play a role, right? Hormones, especially your sex hormones. When I say sex hormones, I mean your reproductive hormones. So with women, we go through pregnancy, periods, all that kind of stuff. Those stresses can also affect thyroid levels. So that could also be one of the reasons why we tend to see these more in women, but definitely women more affected.
Hmm. And we have you to thank for our title, Red Flags. It might not be your thyroid. This was the one thing you're like, we definitely have to talk about this. So sometimes symptoms scream thyroid, but the labs say no, like in our case study, right? Tanya, that's what she heard.
Yes.
What are some signs that point to another root cause? And what else could providers be testing for before making assumptions?
So for let's say for a middle-aged woman, right? Maybe Tanya's 37. This might be early, but perimenopause and menopause, for instance, that gets a little bit confusing. Even for me, the endocrinologist who's seen this, sometimes you want to tease out which is which because the symptoms can overlap, right? Someone comes and they're having hot flashes, there's changes in their weight. Menopause can do some of these. So if their thyroid is fine, and the fact that your at least period is regular now doesn't mean that it can go out of whack too, right? So perimenopause and menopause are some of the things you want to think of because hey, I'm 45. Average age for menopause in America is about 51. So some women go into it much earlier, some in their 40s. So someone is giving you all these complaints. I'm tired, I'm gaining weight, I'm exercising, I'm eating, I'm having mood issues, I'm a bit more anxious, I'm not sleeping well. You check your thyroid blood work and looks good. Okay, hey, let's check her female hormones. Let's see, is she perimenopausal? So those are some of the, or menopausal, those are some of the things you would want to bring up to your clinician. Some of the things that we see, fatigue, for instance, because fatigue is quite common, right? But some people are pretty low on vitamin D. They might feel fatigued. Vitamin B12, they might feel fatigued. So even anemia, right? If someone is severely anemic, they will be cold all the time. They'll be tired. You might lose hair. Your nails might be brittle. So some of these things you want to ask your provider, is it worth checking some of these? Should we do my blood counts? Can we check vitamins? Can we check other hormones if your thyroid function is low?
Hmm. And are there any risk factors that Tanya would be at risk for that made her maybe more prone to having a thyroid disorder?
Yes. So if Tanya has a family history, right, her mother, her grandmother had thyroid disorders, then yes, that might put her at risk. Certain medications, we know that even some of the cancer medications, so I believe Tanya hasn't had any cancer treatment, but that some of the immunotherapies these days that we're using to treat maybe melanomas or certain cancers can cause thyroid disorders. So you want to find out about her medications, or something like amiodarone, which is for your heart, can also result in thyroid issues. So you want to make sure that she's not taking any medications that can affect her thyroid function. You also want to know about just stress in Tanya's life. Stresses are not helpful, right? We know the thyroid responds to a lot of things. Pregnancy can also cause interference with your thyroid sometimes. So, or it can cause a flare of if you have an autoimmune condition underlining that. And then what we call autoimmune disorders, because we're seeing more and more of those where the cells in the body or antibodies that attack your own thyroid gland. Some can cause stimulation and cause an overactive thyroid. Some of these antibodies can cause an underactive thyroid. So for Tanya, could it be that, hey, maybe she does have some positive antibodies which were not checked, right? So her thyroid looks fine, but if her antibody levels are high, some patients or some people would report symptoms of feeling hypothyroid, but their blood work isn't there yet.
And you mentioned perimenopause, and I know the data shows that when it comes to women of color, sometimes we tend to start our period younger and then enter that perimenopause younger too. Do you see that in your practice?
So I've seen a good mix. I do see quite a lot of perimenopause, but in terms of women I have not seen too much of a difference yet in my clinical practice. I actually have some women of color who go into menopause much later. They might still be perimenopausal for a while, but finally become menopausal later, much later in their 50s. So I haven't seen too much of that in my practice, but I do have a wide range of variability in there.
And in terms of Tanya preparing for her visit, What are some other tests that maybe she should ask her doctor to consider?
So I think Tanya should ask not just, when you say, oh, can you check my thyroid? Ask for a bit more detail because some may just check what we call the TSH, which is the thyroid stimulating hormone, but at least a free T4, which is the circulating hormone. You want to find out what that level is, right? Even as a baseline, I think it will be helpful. Um, if there's a concern of Hashimoto's, which is autoimmune underactive thyroid disease, then the antibody would be good to check because her symptoms do seem like she could be hypothyroid. So she should ask, hey, can they check my antibodies? There are other hormones too. There's something called a cortisol, which is a stress hormone. That's one. If there's concern that, hey, she's doing everything and still it's not working, but my thyroid is fine, then you want to ask about your cortisol. We also tend to check vitamin D levels and just your baseline metabolic and blood counts just to see what Tanya's baseline is. So she should ask her provider for some of these labs.
Speaking of her doctor visit, what can she do to prepare for that visit, right? Because well, I guess you can tell us how long your visits normally are compared to primary. But in terms of advocating for herself, because maybe she's already been to a few doctors, maybe not for this, but in the past, right? And she's always getting dismissed.
Yes. So I do, unfortunately, a lot of people do get dismissed, oh, it's your diet, exercise more, lose weight. So researching before you come is always helpful, right? There's so many resources online these days. The Mayo Clinic has some good resources, Cleveland Clinic, they have some of these online. So of course, listen to these type of podcasts, right? Just to educate yourself so that you have an idea. And if you have an advocate, you have a family member who lives with you, knows your lifestyle and what's going on, it would be nice to bring them in as well. I usually spend about 40 minutes, sometimes even up to an hour with my new patients because you want to tease out everything. And what I've noticed, of course, by the time someone comes to the endocrinologist, they've been to multiple people. I wouldn't lie and say, oh, you come on the first day and we figure it all out. No, but talking to people just helps you tease out some things. Some of the few things I noticed, and it might not be thyroid, but processed foods. Oh, she's exercising, yes, but I drink soda all the time. I'm drinking lots of juice. Some of I eat chips, or late at night, I'm having a snack and I'm having maybe my ice cream and my chips. Some of the processed foods do not help the inflammatory process. You're going to be more tired. So this will not show up on blood work, but talking to someone more in depth will let you know that maybe if we fix her diet, let's incorporate cleaner foods. You'll see that this helps you feel better overall.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
So when it comes to that visit, that 40-minute visit with you, what can Tanya expect is going to take place during that time?
I think one of the key things is to listen. So I asked Tanya, hey, Tanya, I've gone through your chart. I give them a form to fill, about symptoms, your history, just so that I know that, okay, hey, maybe Tanya's mom had thyroid issues. So in my head, I know, okay, hey, Tanya's at risk. Or maybe Tanya's had some issues with pregnancies or her periods have become irregular. She'll there's a form where you write, oh, I've gained 20 pounds, I'm constipated. So there's a whole review of systems that Tanya will fill, so that I review that with her. And then I let Tanya do most of the talking in the beginning. How long has this been going on for? What have you noticed? What are you struggling with? What's bothering you the most? So as we talk through all that, you listen and understand what's important to Tanya. Maybe, hey, this weight gain is really bothering me. It's affecting my quality of life, my self esteem, so that you know what matters most to Tanya. It's hard to say you will fix everything at a go. And thyroid, if it ends up being her thyroid, right? Of course, we have to do blood work. So if you come see an endocrinologist, expect some blood work, right? We do a bunch of tests, lots of hormonal testing, and also baseline testing. I may end up checking an A1C to screen for diabetes as well. So lots of blood work will be done for the first visit. When those results come back, then we will review that and say, okay, Tanya, hey, your blood work looks good, but maybe your antibody levels were high. This is what I'm thinking. Let's try this. Some people will realize they might need a low dose of thyroid medication. Give it a few weeks. Tanya will come back. We'll talk about it and say, how do you feel now? Oh, we'll know if Tanya has made some changes to her lifestyle. Has this helped? No, it didn't help. And then we will take it from there. So definitely expect a lot of questions, but I prefer that the patient does most of the talking and blood work. Of course, a physical exam too. We don't forget that part. You will check Tanya's neck because sometimes people have an enlarged thyroid gland right at the front of their neck. They may not have noticed it, but you touch it, you realize, it feels full. It looks like it's a bit bigger. And they're like, yeah, sometimes food gets stuck, So you might end up getting an ultrasound just to look at the thyroid gland. And sometimes that will even tell you, hey, they have some inflammatory changes. So that kind of tells you, this could be an autoimmune thing going on. So those are some of the things that Tanya should expect when she comes to see us in clinic.
Okay, so now she's been diagnosed, right? And now she's back for that follow-up. So tell us kind of like what are the similarities and the differences if someone's diagnosed with hyperthyroid versus hypo, what that conversation might be like.
Okay. So if let's say we find out that Tanya has, we'll start with hypo, which is an underactive thyroid. So, okay, Tanya, hey, this is what your blood work shows. Could be the reason why you're feeling so fatigued, you're having trouble with your weight, and you're just not feeling yourself. Then we give Tanya options, of course, lifestyle and everything. Maybe because I'm biased, I'm an endocrinologist, but lifestyle is key. I believe that eating well, you can't beat eating well and staying active. And of course, staying hydrated. It does not change the cause of your thyroid disorder, unfortunately, but people feel better when they eat better. You eat cleaner. So definitely that advice comes in each time, right? And helping someone obtain a healthy weight. It is definitely not easy, but Tanya, maybe these changes in our foods, increasing the physical activity. Yes, it's difficult. I'm tired, but let's try and push a little bit more. And then we talk about medication. So we have our labs and it's showing that she's hypothyroid. How do we treat her? For hypothyroidism, we tend to do a pill called levothyroxine or Synthroid, right? It's a pill you take once a day in the morning. It's supposed to help with, it just gives you a little bit more thyroid hormone in your system to give you that perk or that energy you need if you were hypothyroid. It does take a few weeks to kick in. So you're not going to feel better on day 2. You definitely have to give it some weeks, right? So if someone is hypothyroid, which is an underactive thyroid, then we're thinking medication. So levothyroxine or Synthroid, some people would go for natural medications like the brands called Armour Thyroid, there's Pork Thyroid, there's different brands, but we start with the pharmacology, the synthetic one called levothyroxine or Synthroid for the most part. And then if her blood work showed that she was hyperthyroid, right? If that means her thyroid is overactive, she's making too much thyroid hormone, then our treatment is to reduce how much thyroid hormone she's making so that she's not jittery and anxious and sweaty all the time. So, of course, that has medications as well, but that you can either go the medication route or there's radioactive iodine to kind of zap the thyroid. The final or last thing would be surgery if your first treatments don't work. But for that too, there are pills, something we call methimazole that you can take, which is safe, just to help reduce how much thyroid hormone. And all this you have to keep monitoring. So blood work is key. You cannot take these medications and not show up again. Every few weeks or months, you will have to repeat blood work just to see how things are going, and your medications can be adjusted as well.
I think that was very, very clear. And I like that you mentioned the blood work multiple times so that people won't be so surprised.
Yes.
Um, and what if Tanya, like a lot of people, right? We give them these diagnoses, we give them our recommendation, and they opt not to take those recommendations. What can she anticipate if that's a choice patients have, right? That is a choice.
Yes. I've actually had someone told me, and I always say this story. I diagnosed I think someone diagnosed with hyper, which is an overactive thyroid. And she came to clinic and she had lost weight and she was happy with the weight loss. Of course, she had the heart racing and the sweating, but she really liked the fact that she'd lost a significant amount of weight. When I told her about the treatment, that, hey, if we treat your overactive thyroid, you will gain some of this weight back. Unfortunately, some people might gain a little bit more than they want. She said no, she wouldn't take the treatment because she liked her weight loss. In that period of time, right? In that short time, the acute setting, okay, hey, you can manage, but an overactive thyroid is not good for your heart long term, right? Because if your heart is beating too fast, it has complications of its own. Sometimes it can beat out of whack. I would send you to the ED, right? Because then you'll be extremely fatigued. We can go into something called AFib. You definitely do not want that. It's not good for your bone health if your thyroid is overactive long term, so you will not see the effect when you're maybe 35, but down the line, you're at risk of osteoporosis. That unhealthy weight loss, and also if your overactive thyroid was due to autoimmune disease, some people develop eye symptoms where your eyes are bulging. It's part of what we call Graves' disease. So those are some of the things that may happen down the line. And in just quality of life, you will not feel good if you're untreated. For the hypothyroidism, severe hypothyroidism, untreated over time, the fatigue gets pretty severe. People end up in the hospital with, we call it a mixed edema coma. You're not in a coma per se, but just extreme fatigue, and like everything is just going downhill. They don't even have the energy to move or do much, right? This is if you do not treat this over time. If you're a woman and you're getting pregnant, you can have miscarriages just because you did not treat your thyroid issues. So I think, yes, we all don't want medication. Sometimes it's hard. I have to take this pill. For example, for the hypothyroid, you want to take the pill. I mean, you have to take it lifelong for the most part. So some people don't want to do that. And then I'm frustrated. I don't want to take this. I want to go natural, true. But just remember that the outcomes are not good, right? Over time, your body cannot cope because you need your thyroid to survive, right? It's one of the main organs or glands that you need for survival. So we do say, yes, you do have a choice, but I think you want to make sure you're doing the right thing for you, because if not now, later on, you will see the effects, and they're not good effects.
Yes, thank you. And I have seen those patients where it got really severe and they were admitted to the hospital. And not only were they really weak, couldn't get out of bed, totally dependent on the staff to care for them. A lot of times they were very confused, and they never returned back to their normal cognitive state.
Exactly so. So I am definitely not a fan of. I think there's a lot that we don't know about, that people don't know about the thyroid, but it is key for your survival and good quality of life. So I think it's one of those things that if it's found and it's, hey, we repeat it and it's still showing that you do have a thyroid disorder, I think you're better off treating it than not.
If someone's listening to us talk about Tanya and they see themselves in her story, what can they do when they go see their primary care in terms of when should they ask to see someone like you?
So some people's primary care, so it depends on who you're seeing. I've had some people whose primary cares are very knowledgeable when it comes to thyroid disorders. They make a good diagnosis. They check all their panels and they say, hey, they make the right diagnosis, they put them on the right medication and they adjust it accordingly. But sometimes people just don't feel right? Maybe, hey, I'm on this dose and I just don't feel like myself. I still feel like, hey, this weight is not improving, or my hair is still dry. I'm still constipated. If you feel like your symptoms are not being well treated, definitely ask to see an endocrinologist, and it could just be a second opinion. And it could be, as I said, maybe it's not the thyroid, it might be something else. But the diagnosis on its own doesn't mean that you have to see an endocrinologist. It's more of, how am I being treated and how do I feel? You've given it a few weeks. I've been taking this medication for 3 months. I don't feel good. I feel worse. Definitely ask for an endocrinologist, maybe for further testing. But I think we have good primary care physicians and nurse practitioners and teams that are helping people from a thyroid standpoint as well. So it's more of an individualized thing.
So, where are we still missing the mark when it comes to thyroid research, especially in Black and Brown communities?
Yeah, so there's so much about thyroid, but I feel like sometimes we're just not included in some of these studies, right? So there's a research that was done. It has maybe 80% Caucasian, and it's 10% minorities, and then or maybe 10% African American, and 10% maybe Asian or Hispanic, right? But then we're generalizing these studies or the data to all of us, and sometimes we just don't fit in that box. So I think we should, if you go to your doctor's office and there's a research and they ask you to participate, of course, within reason, I think it's fair to enter, try and say, hey, maybe let me do my research, read on it. If it's safe enough where you feel like this might be helpful to our community, then yes, we should join. I think if we had more physicians of minority too, just to advocate for us as well, right, that would be helpful. But I think we should just participate. And on the clinicians end as well, maybe we doing more research too would be helpful, versus us relying on other people to do it and then we applying it to our clients or our patients. So I think as patients, yes, if you're approached or there's a study going on, there's something going on NIH, you've seen something, we should get involved, right? And the clinicians too, those of us in the minority, yes, we should also go into research just so that we can gather more data to help people of color as well.
Yeah, huge fan of research. As we close out, what are some helpful resources for Tanya and our other listeners on where they can go learn more?
What I'll tell Tanya, right, because there's so much online. There is almost everyone is a thyroid expert, these days. So go through legitimate sources. I know it's hard to read through all these, but I feel like reputable organizations, hospital systems like the Mayo Clinic, Cleveland Clinic, NIH, they do have resources online for thyroid health. The American Thyroid Association is a very good one. Okay, the Endocrine Society. So if you go online and you look these up, and you type in thyroid health, they do have good information, which is broken down enough for people to understand, right? Not just using medical terminology, but then terms for Tanya and for anyone who didn't go through medical school or nursing school or medical education, right? These are helpful tools. And also, I think as clinicians, as providers, we should give our patients resources too. In our healthcare systems, there are resources. Someone has a thyroid disorder, there is paperwork you can print out, So I think we should do our part and point our patients in the right direction, because there's so much, people have books on thyroid. Some of these are just, and people are just coming up with stuff because you can make good money from thyroid, Don't eat dairy, don't eat gluten, There's so much in there without any basis. So it's hard, but ask your doctors too. I read this, I'm not sure. What do you think? And it'll keep your doctors too on their toes to research it for you and give you good, valuable answers. So I think that would help Tanya.
Yeah. So, what's the last thing? What's one thing you want everyone to walk away with when it comes to thyroid health and self advocacy?
So, thyroid disorders cause a lot of symptoms, right? But you want to do a bit of research too on your own, because some of the symptoms, yes, could be your thyroid, but it could be menopause. It could be, hey, I'm just not eating well. There's so many other things. So, yes, if you think about thyroid, jot your thought process, jot what you're going through down. Put this on paper. Do see your primary care doctor or team, or your nurse practitioner. Ask questions. Put everything down, because I know it gets overwhelming sometimes. People don't know what to ask. So write it on your paper, put it on your phone. Ask questions. Ask for testing. Is it my thyroid? At least if it's not, we will know through blood work. So ask. I think what I want people to take away from today is ask questions. That's why we're here. You're not sure. It might not be, but ask. The more you ask, the more you'll know, and read. So I think those two things: ask us, read on it. If you're not sure, come back, ask us, right? It's our duty to answer your questions and help you get better.
Thank you so much. If I know you're transitioning into your soft era, but if someone wants to connect with you, is there a way for them to do that?
I still do work at my current location at Mary Washington. So yes, I am still available. My soft girl era might be brief, short-lived. I do want to travel, but I think I'm still going to be available. So I am on LinkedIn. You can reach me that way. But yes, through the Mary Washington healthcare system. I'm currently at the Stafford Hospital. So yes, that's one way to find me if you're looking for me.
And congratulations for being the top doc in 2025 too for Northern Virginia. We appreciate your commitment to the community and to medicine in general.
Thank you. Thank you so much.
We want to thank you for helping us dig deeper into thyroid and beyond. Everyone, if you love this episode, be sure to share it, leave us a review, and follow us and come back, because she's going to come back and talk to us about GLP-1s, a very, very hot topic. And you can email us your questions at tmi.melanin@gmail.com. If you haven't already, there's still time before we finish to subscribe, leave us a comment, give us a thumbs up, go over to Apple and Spotify and leave a 5-star review, and let everyone know how valuable you found this, so that when people like you look for topics like this, will show up higher in their search results. At the time of this recording, we release new videos every Sunday at noon Eastern on YouTube, LinkedIn, and Facebook. And we drop the audio at 5 a.m. so that our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.